Prostatitis, is this really a diagnosis, or is it a diagnosis of exclusion because just there's nothing else that we can find? Sometimes you blame the organ you have. So if women have pelvic floor dysfunction, they don't have a prostate, so they don't have prostatitis. They may have interstitial cystitis. So is the man having interstitial cystitis, which is like an inflammatory situation in the bladder? Rather, what's your or does it matter? Does it matter? What is your method as a physical therapist, expert in male pelvic dysfunction? What is your method of assessing what's going on? What's the root cause?
So that's a loaded question. So let's start. Chronic abacterial prostatitis is, as we know, probably 95 to 98% of the cases that most men will come in with, correct?
Yeah.
There's an absence of bacteria. You won't find it in the urine in most cases, even when doing semen analysis or semen culture, yeah? Sometimes you'll find like Enterococcus faecalis or these weird bacteria. And most research actually states that some of this bacteria is actually quite normal to be there. So then what the hell is prostatitis? So if you break it up, it's inflammation of the prostate. Now, we do know that acute prostatitis is a thing in men from ages, let's say, I'm going to use an arbitrary age, but let's say 20 and above, it happens. But acute prostatitis is usually accompanied by systemic symptoms, which is systemic. You have fever and malaise and certain other things that would indicate an infection. We don't see this with our chronic abacterial prostatitis patients.
So the guys you and I see probably, and that's 95%, it's probably non-bacterial, right? And no fever, and just they feel off in their pelvic area.